Good afternoon and welcome to DC Health's Let's Talk About It. I'm Melinda Salinas, your host, and today we have a very special episode focusing on a topic that affects many district residents, brain health. Joining us to talk about it are Health Systems Director Karen Fagan and Interim VP of Programs and Services Sheila Griffith of the Alzheimer's Association and DC Health's Dementia Health Coordinator Tehitna Chamiso. Before we dive into today's topic, I'd like to give you the opportunity to introduce yourself and tell us what fuels your passion to work in a career in public health.
For me, my mother was diagnosed with Alzheimer's and dementia at the age of 57, so she was considered younger onset. And when she was diagnosed, this was in the 1980s when there was very little that we knew about dementia and Alzheimer's and very little programs and services. So that really is something that developed my passion and to join the Alzheimer's Association to help others, caregivers and families who are dealing with something like dementia or Alzheimer's.
Well, for me, my background is in nursing home care and assisted living. And many years using both the Alzheimer's Association and hospice as resources in nursing homes and assisted living and the outside community. So when I left those types of industries, I decided I really wanted to work for a company like the Alzheimer's Association and just continue that mission that we have to help serve people living with the diagnosis of Alzheimer's disease or dementia and their caregivers and their families. So that's what makes me get out of bed in the morning. It's helping those caregivers and people living with the diagnosis.
Great. For me, it was, I think growing up, I wanted to be a doctor, as every foreign parent wants us to be. But I think it was in college when I was doing a lot of research in terms of food access, and I saw that how food access, access to education, all this is kind of connected, and everything is intersected, and kind of drew me to public health, kind of working to address before health issues occur, looking at what we can improve or reduce the risk for. So that's how I got into public health.
Wonderful. Thank you all for, first joining us here today, but also sharing your passions. So I'm excited to have this discussion. So to lay the foundation for this conversation, let's begin with what brain health is. So as described by the National Institute of Health, brain health is how well a person's brain functions across several areas. These include how well you think, learn, and remember, how well you make and control movements, how well you interpret and respond to emotions, and how well you feel and respond to sensations of touch, including pressure, pain, and temperature. So we're gonna jump in and talk about it now. Our first question is for Tehitna. What is DC Health's role in promoting brain health care and support?
Great, thank you so much. So before I answer that question, I want to kind of provide a background information in terms of the dementia climate in the district. Currently, we have about 10,000 individuals that have been diagnosed with dementia, and we've seen an increasing trend as the aging population is living longer, right? And without a cure or the treatment for Alzheimer's disease and dementia, we're seeing a higher burden. The data in the district shows within the past 10 years, there has been an 18% increase in Alzheimer's disease and dementia-related mortality rates. And this is very heightened. If you're looking at wards 5, 7, and 8, there's a higher burden over there. So we're looking at it from a public health perspective. What are we doing at DC Health to kind of address these issues? So in 2019, DC Health created the Brain Health Initiative under the Cancer and Chronic Disease Prevention Bureau with the aim of increasing awareness about brain health and cognitive health. And the initiative really works to improve environmental and policy changes that address Alzheimer's disease and related dementias. So our bureau really focuses on modulating one of our risk factors, providing resources and supporting community members to kind of improve the healthy lifestyle.
And how does DC Health collaborate with other government agencies, healthcare providers, and community organizations to enhance dementia care and support?
Right. As you can imagine, dementia, it's not a disease that only affects one person. It affects their family, their caregivers, community members, and the district in general, right? So because of this, we have to kind of work collaboratively. In 2021, we launched our Brain Health Advisory Coalition, where we're working with different government agencies, so DACL, Department of Healthcare Finance, We're also part of this coalition. We have persons living with dementia and caregivers that are a part of it, but also other entities. We have GW's Institute of Brain Health, and of course, Alzheimer's Association, who is here today, that is a part of it. So we kind of come together, look at different issues that we're seeing in the district, and kind of figure out how we can collaboratively work to make a greater impact.
Wonderful. Thank you for providing that framework and what our role as DC Health is to assist individuals with brain health support. Our next question is for Sheila. Can you provide an overview of dementia and Alzheimer's disease and tell us about its impact on brain health?
Yes, so I just want to add also, so thank you for considering us a resource. So that's what we consider ourselves, is that framework of DC Health, and we're one of many resources I know that you guys offer the community, and we're one of them. And we are the Alzheimer's Association, but we also cover any other dementia as well. So I want to make that clear, that even if you don't have Alzheimer's disease, if you've been diagnosed with another type of dementia, and I'll talk about that in just a moment, you're still somebody that the Alzheimer's Association would like to try to serve. So consider us a resource. But that's one of the top questions we get at the Alzheimer's Association. Part of my role in programs and services is to really do this type of community outreach and education. And so I talk to a lot of organizations, a lot of groups, senior groups, all sorts of groups, church groups. And they all ask, is Alzheimer's disease dementia? And is dementia Alzheimer's disease? Is that the same? So they're not. And the simple part of it is that Alzheimer's disease is what it sounds like. It's an actual brain disease. It's a progressive brain disease that actually kills brain cells as it progresses. There's no cure. And right now we have some drugs on the market that are just coming out that are starting to affect the biology of the disease, but we have had also medications on the in the marketplace for quite a while that help with some of the symptoms, but don't cure it and don't stop the progression, unfortunately. So Alzheimer's disease is the disease. So what's dementia? Dementia is like an umbrella term, is how we talk about it in our education. So think about a kind of a large umbrella called dementia. And these are symptoms like problems with thinking, problems with memory, problems with planning, a lot of the executive functioning, how am I going to get out of here today? Where's my car parked, and how I would get home. So that kind of planning and thinking becomes affected. And it's what we call dementia. It could be a symptom like fever or body aches, could be a symptom of something else like the flu or whatever. So dementia, when you have these symptoms of dementia, you have to make sure that you figure out why it's happening, just like you would if you had a fever or something else happening. So dementia can lead most often to Alzheimer's disease. It's under the umbrella. There's a lot of diseases there, and Alzheimer's disease is one of them, and it's the most common form of those dementia symptoms. Some of the other diseases that could be under the umbrella are vascular dementia, Lewy bodies dementia, and even Parkinson's can have dementia as a component of the disease, so symptoms of it. So
That's a really great way to visualize and put it, because oftentimes these two terms are interchangeably used together, but seeing it as an umbrella of dementia and then Alzheimer's being underneath that, along with some of the others that you mentioned. What are some of the common signs and symptoms of Alzheimer's disease that people should be aware of? I know you mentioned some symptoms for dementia, but are there any others specifically to Alzheimer's?
Well, they're kind of like, as I said, we talk about all other dementias also because it can be confusing, and they all should be warning signs. But with with Alzheimer's disease and the Alzheimer's Association, we talk about 10 main warning signs. And I won't go into depth about each one, but let me say, I think the hallmark of some of the signs of those 10 signs are problems with memory. Anytime you have a problem with memory, you should be talking to a doctor about it. Keep track of it. What are you not remembering? Is it just you can't find your way home? Is it you just can't remember the names of your grandkids? Depending on your age, it could be leading to something. And so it's something that you should definitely get checked out. Another kind of important sign of the 10 signs is to not being able to retrace your steps any longer. So I parked my car in the garage right across the street. If I had Alzheimer's disease or dementia that might be leading to it, where's my car? I don't know. I don't even know. I don't maybe know I'm on the 5th floor here. So I'm not retracing my steps. I've lost that capacity. It goes on from there. It's the kind of forgetting that is interrupting your daily life. So not just you forgot to eat breakfast today. It's more than that. So
It's more consistent, I guess.
and deep, it's a long term, and it's not just today. It's keep track of it. How long's it been going on, and see your doctor.
Thank you. That's a very important tip to kind of keep track of those things and how often it's happening. What is it that you're forgetting? So thank you, because that's a really great tip to keep in mind, especially if you're looking forward to talking to your doctor about it.
And if you want to know the rest of the 10 signs, just go to our website. I know we're going to talk about that, but alz.org. You can see all 10 signs and an explanation of why it's different than normal aging.
Thank you for dropping that resource.
You're welcome.
And just to add to that point, in the district, about 10% of individuals have said that they have had, 45 and older, have said that they're having some type of memory issues, symptoms that they're experiencing. But only 43% have talked to their healthcare professionals about these symptoms. And it's
Wow.
really important for us to acknowledge, like, you're not forgetting things just because you're getting older. It could be something serious, and you should definitely talk to your healthcare professionals about it.
Perfect, taking your health serious, your memory serious.
Yeah, your memory as seriously as
Yeah.
everything else.
And to remember also that it's not necessarily dementia. There could be some other underlying condition that could be causing short-term memory loss as well.
Thank you for adding that. It's very important, especially as we're learning that dementia is kind of the umbrella term. There are other things that fall underneath that. So how does Alzheimer's disease progress over time, and what are the stages of the disease?
Well, I'll go ahead and take that one. So there are many theories that there are 7 stages or 5 stages, or the Alzheimer's Association, we talk about a continuum that involves 3 stages. And so we think that things, for people who have Alzheimer's disease, things are happening much earlier in their life. So it's not just at 65, boom, there it is, it's in your brain. That might have been happening years before. And so we talk about there's biological changes that we suspect are happening early. Then we're starting to see that if you have a loved one who gets lost, especially maybe in the city, can't ride public transportation anymore because getting lost continually, and really needing somebody with them to get them from A to B when they never needed anybody before. So those types of things start to add up. We call that the very early stages or mild cognitive impairment. And even then, we should be talking to our doctor. Just, when we go in for our checkup, and Karen will talk more about this, but making sure that we have our brain and our memory as an important piece of our health. But after you're experiencing mild cognitive impairment, it will lead eventually to the early stages of Alzheimer's disease, which it's just getting worse. We're forgetting more. It affects me in a different way than it might affect anybody else. Even if they're the same age as me and been diagnosed on the same day or had the same problems, maybe you can drive a lot longer than I can because you're not getting lost as much, but I can't go on the bus or on metro or drive because I'm dangerous, I'm putting myself in danger. So it affects us all differently. And time-wise, it affects us differently. So you could be in the early stage much longer. I'm in the early stage for a short time, and I'm right into the middle stage where things are getting really difficult for me now. I'm not able to really function. My activities of daily living I'm not feeding myself, I'm not taking my medication the right way. I'm definitely getting lost, and I'm forgetting appointments. And progressing to the late stage, which is the end stage where there'll be 24-hour care needed, whether through family, friends, or paid caregivers. And I'll need help with everything: eating, drinking, toileting, everything. And I'll eventually, with Alzheimer's disease, we stop swallowing and breathing, and all those functions kind of cease. So.
And to also add, in those middle to late stages, that's when communications gets very difficult and where behaviors come into play, and how it's very difficult to get your person to, take care of themselves or to take their medicines or to do what you'd like them to do.
So you remind me to take my medicines, and I say no. Right? not gonna do it.
But you have to.
But I'm not gonna do it.
That's all really great information, especially at looking at it as a continuum, as you mentioned, and not necessarily in these stages that will look the same as everyone, because it impacts and affects everyone differently. So I think that that's really important to highlight in this continuum of the progression of the disease. Are there any known risk factors such as genetics or lifestyle choices that can increase the likelihood of developing Alzheimer's disease?
Yes, so we say there are three major factors that for Alzheimer's disease that you should consider. The first one is age. So anybody who is over 65 is at risk for Alzheimer's or higher risk for Alzheimer's disease. That risk increases every 5 years. It incrementally increases. So we have a statistic: people over 85, anybody age 85 or older, a third of that population will have Alzheimer's disease. I always, when I talk to seniors and anybody, try to flip it on a more positive side, that there's 2/3 of those people who are over 85 who are aging normally. They don't have Alzheimer's disease. They're, having other maybe chronic conditions or whatever else is happening, but they don't have Alzheimer's disease. But anybody over 65 and even under 65, Karen spoke about her mom, and the younger onset Alzheimer's or early on Alzheimer's happens earlier than 65, and that is a smaller group of people. In the U.S., there are 6 million people who are living with Alzheimer's disease right now, cared for by about 11 million unpaid caregivers. So it's really it's a disease that's devastating health-wise and brain-wise, physically, but it's also devastating financially as well. But some other risk factors are genetics. That could be something that runs in your family and that you should be aware of, just like you are about any other disease that runs in your family. We always caution people that anything you can do to lower risks, like lifestyle-wise. So if you're somebody who has either high blood pressure, high cholesterol, I'm sure we're all going to talk about that, but any of these even depression, stress, high stress, can lead to dementia-like symptoms or raise your risk for this disease, Alzheimer's disease or dementia.
Wow. And Tina, you also mentioned that specifically in wards 5, 7, 8 here in the district, there's a much higher risk factor there. Can you also speak a little bit more to what Sheila has mentioned in terms of risk factor or lifestyle?
Sure. Actually, in 2020, DC partnered with GW Institute for Brain Health to conduct a brain health needs assessment for the district to kind of identify, what are the permanent risk factors that are modifiable, things that we can make changes to, right?
Mm-hmm.
So in the district, from this outcome, vascular risk factors, there's 3 types of modifiable risk factors: vascular risk factors, psychosocial, and lifestyle risk factors. That some of them you have mentioned already. We saw that there's vascular risk factors were very prevalent. So individuals that have midlife high cholesterol, midlife hypertension, diabetes. So looking at these things, making sure that we're managing them at an earlier midlife stage, right? Not waiting until we're 65 to kind of like, let's start working, but like earlier, managing those diseases, improving your health lifestyle, eating healthy, exercising, managing depression, getting services for that. Also, traumatic brain injury. There's a large evidence for that too. That increases your risk for getting cognitive decline, which kind of increases your risk for dementia as well. So kind of monitoring these issues that you might see early on, addressing them, utilizing different services that are available can help you reduce your risk. You can't prevent it 100%, but it reduces your risk.
Mm-hmm. So it sounds like some of the known risk factors include age, so 65 and older, but could also you could also have early onset of the disease, genetic factors such as does it run in the family, and then other lifestyle choices, but also other chronic diseases that individuals may have, like hypertension, vascular disease, diabetes you mentioned as well, or trauma or any kind of brain injury. So all those things to kind of keep in mind. And as you mentioned, I think that was a very important note there of, really trying to tackle these, especially if you've been diagnosed with some of those chronic diseases earlier on. Karen, the next question's for you. Are there any effective strategies or interventions for preventing or delaying the onset?
Well, as we've all kind of discussed and touched upon, there are the 4 pillars of good health. So you want to maintain a healthy diet, you want to exercise, you want to maintain cognitive stimulation, as well as social stimulation, stay engaged in life. Other things you can do are to limit your alcohol intake. If you smoke, quit smoking. If you don't, never start. Get enough sleep. Anything that our doctors tell us to do that's healthy for our body, that's healthy for our brain as well. And so we really have to focus on things like that. So for instance, like maybe adjusting our diet, our nutrition. Diets that are promoted for brain health would be something like the Mediterranean diet, meaning meats and fish, vegetables, healthier oils, so olive oil, avocado oil. There's also the DASH diet, which is used for maintaining hypertension or to lower your blood pressure. And then there's also the New Mind diet, again, low fats, healthy grains. And if it's difficult to obtain some of these things, and you still want to, maintain your cultural foods, and I'm Italian, I want my pasta. Substitute maybe fats for a healthier oil. Reduce your sodium intake. So those are things that you can do to keep your body and your brain healthy.
And everything in moderation, right? I mean,
Exactly.
I always tell people that too. You can't give up pasta, right? You can't. That's
Right.
too difficult. That's too
Can't do
difficult.
that.
You can't give up red wine. That's too difficult. So, but everything in moderation.
Yeah, thank you. Yeah. So are there any specific brain exercises, in addition to what you've already mentioned in terms of taking care of your health, or mental activities that can help improve brain health and potentially reduce the risk of cognitive decline?
Well, we probably both can speak to that, but we'll talk about it. We always, in our education, talk about how to work the cognitive part of your mind and to try to exercise your brain, basically, is what it is. And so not only keeping all those factors in check, making sure that you have adequate blood flow is really the key here, so that the blood is going up to the brain. But then what else can we do? Well, we can go ahead and really challenge our brain to learn new things, or to, we talk about puzzles all the time, and that's kind of well known, but just any kind of difficult, challenging puzzles, like some people are very challenged by Sudoku and Wordle and just a crossword puzzle. But what about playing chess? If you're a checkers player, trying chess, trying to learn chess. So as adults, it's hard for us to learn these new types of things, like a new game, or better yet, one of the most challenging things to do cognitively is learn a new language or learn a musical instrument. So I always say, I think that's why we teach children early, a new language or a musical instrument. It's easier for their brains. Their brains are nice and new and ready to go. And ours, we have to work at it a little bit. So challenge your brain in any way you can. And seniors always ask me, well, what's the best brain app or game app I should put on my phone? And I say the best one is a free one. So don't pay for it, because there's so much available that's for free. And just do, something that challenges you cognitively. Even watching a documentary or watching this show today is I think something people can learn from, and that's challenging your brain.
Was there anything else that you wanted to add to that?
No, I think Sheila.
I did want to add, I know earlier we were talking about managing other cognitive diseases as well. So within our bureau, for instance, if individuals want to stop smoking tobacco, we have resources for that. We have our quit line from tobacco control program. We also have a diabetes prevention and management program. So individuals who are pre-diabetic or have diabetes, we have resources for them to kind of learn in terms of what they can do to kind of self-manage those diseases as well. We have our Living Well workshops. It kind of provides a lot of information, increasing the literacy in terms of like how you can have a healthier lifestyle, right? And then we also have our mailing cards, which works to kind of help individuals kind of manage their cardiovascular diseases in the district. Because of course we're looking at these are the risk factors that increases the risk. And of course, our Nutrition and Physical Fitness Bureau, they've been on the show before, and they have nutrition program, they have nutrition education, which I think is very helpful. So there's a lot of resources out here.
And even with limited mobility, I just wanted to say that too, there's chair exercises that you can do, and it's just anything you don't do normally to get your heart rate going is good for your brain.
I love that, the fountain and sharing of all these amazing resources that are available. As from what I'm hearing from the discussion, that's very critical to maintaining a healthy lifestyle, but also keeping your brain functioning and working and challenged. Well, our next question, can you provide some insights into the importance of healthy lifestyle, including diet and exercise, and maintaining optimal brain health? Now, we've touched base a little bit on these throughout, but I think that one of the things that you mentioned that kind of just had me thinking here was the modifying your diet choices. It doesn't necessarily mean that you have to deprive yourself from the foods and things that you enjoy eating. So especially if you come from a different cultural background, is incorporating healthier options to still having delicious dishes. It's also a way of kind of working your brain and thinking of, how to reinvent a dish that you like. Is there anything else?
Yeah, actually, well, there's a lot of research going on right now in looking at healthy lifestyles, and it's never too late to start exercising. Low intensity exercise in moderation, maybe just as, pardon me, as Sheila mentioned, chair exercises, working on your balance. All of this has been found statistically to slow any type of cognitive decline. In fact, there have been some studies looking at people who are in the very early stages, so at that mild cognitive impairment stage, and they just start to exercise a little bit, or they might follow a high intensity, and it's found that it doesn't matter what you do. If you stretch every day, you can still lower your risk for developing dementia and progressing. It can slow that progression. So that's very important. And research is continuing to look at this. We have a very large 2-year study, over 2,000 participants. And the participants in this study are coming from a variety of different ethnic groups. So African American, Asian, different cultures, different geographic locations. So we're really looking at, expanding our reach and expanding our research. And what's key in all of this is if you can reduce that inflammation in the brain, then you're increasing that blood flow to the brain. And that's where also, taking care of yourself and sleeping is so important. We rest our bodies, but when we sleep, we also are resting our brains. So it's just very important.
The comment with regards to just stretching being something very helpful, I think that's also just important to consider, especially when you have a very sedentary job. And even like with coming out of COVID, that a lot of folks were kind of confined to their homes, is very important to keep important. I love the idea of doing chair exercises as well.
No matter what age you are, or,
Yeah.
whatever your mobility is.
Yeah.
You can do chair exercises, stretching in your chair too. It's helpful.
Part of the healthy aging as well process.
And that also helps with reducing falls, which
I was
kind
gonna
of
say,
contribute to traumatic brain
with
injury.
seniors
So-
too, like
okay.
keeping their balance up so they don't fall. And then, because people with dementia and Alzheimer's disease are at risk for falling.
Yeah.
Their brain is, they have a progressive brain disease. Things aren't working right, and they might not interpret what is happening. Like, is that door, is there a step there or isn't there? So it's very important for them to have good balance and to everybody be aware that they could be at risk for falls.
There's also a disruption in how their tactile function. So picking up things or walking, and that disruption can also affect and increase their fall risks.
How does the Alzheimer's disease impact caregivers, and what support and resources are available to them?
Well, we've talked a little bit about, Sheila mentioned caregiver stress. That is just huge. As I said, it was a family caregiver situation for me. My mother was diagnosed at the age of 57, and the stress of caring for her. The caregiver forgets to take care of themselves. And, the person thrives, and the caregiver is experiencing the stress. And that's sort of what happened in my family. My father had a heart attack. And so, you're kind of at a loss then as to what to do with your person. Other things are just, what are those next steps? Where do I get the education? How do I navigate this landscape? And again, talking about my own personal experience in the 1980s, we didn't have these resources available to us. We just kind of went, we winged it.
Yeah.
You say it that properly. So it was just you just did what you needed to do. And so those resources were not there. And so the challenges that caregivers face are, what do I do for myself? What do I do for them? And also, where am I at in the moment here? These cognitive changes, these behavioral changes, communication changes, I don't know what to do. And I'm stressed out. And that's where our 800 number comes in. People can call us any time of the day or night to just let us help them get through those rough spots.
And what is that 1-800 number?
800-272-3900. And I was just going to add, we have many brochures from the Alzheimer's Association. This one's about behaviors with people who have Alzheimer's disease, but I'm actually going to leave them here for you guys if you like them. But on every brochure, the back of it gives this type of resource information. So as we said earlier, we want to be a resource to everybody in DC and DC Health, and to reach out to us, and it could be through our helpline, 800-272-3900. We will talk to you in any language that you'd like to be spoken with in. You just have to say what that language is. And we could do everything from just answer a simple question about dementia or Alzheimer's disease, or as Karen said, you could call in the middle of the night in crisis because your loved one is doing something that you didn't expect, or a behavior, or something's happening and you need help and advice. And we can give you some really good advice on what to do in that moment and in the future.
And if I could also add to the other things that are really affecting caregivers are the financial burden. We talked about how many unpaid caregivers there are in the country and in the city. And, how do I pay for care? This is care that's not covered from Medicare. And so that creates a huge challenge for families in caring for their people properly.
And just to add on that, Karen, in the district currently we have about 14,000 caregivers that are unpaid providing care, and usually, they're what we call there's a sandwich generation where they're caring for their own younger children who are under the age of 18, and they're also caring for the older adults, and that causes a lot of stress. On top of that, they're dealing with life. It could be very stressful. They have work, so many things. You said financial issues, so that can be very challenging. And that puts a lot of toll on them. Some days they're providing more than 20 hours of care throughout the week. So at this point, I think it also causes them to stress, causes emotional, it could be, they can fall into depression, and they can also kind of forget to take care of themselves, right?
Yeah.
And if they're not taking care of themselves, if they're not going to their regular checkups, if they're not feeling well, they're not going to be able to care for the persons that have been diagnosed. So it's really important for us to kind of support our caregivers as well. Make sure that they are aware there's resources here. We want them to utilize them.
I think the most, one of the things that's standing out to me right now also is that we discussed that stress and depression could also be a risk factor for developing dementia or later in life as well. So that's very, I think, interesting to note there. But as we talked a lot about the Alzheimer's disease or dementia and how it impacts the individual, but also keeping in the forefront as well that it's a disease that doesn't impact the individual, but also their families and caretakers. Well, this kind of leads us to our last question for today. And so looking ahead, what future plans or initiatives does DC Health have in place to further improve dementia care and support services?
Great, that's a great question. So we have a lot of exciting activities that are coming up. Currently, you guys might have seen it. We have launched our brain health awareness ads. So we have information about signs and symptoms, what to talk to your doctors about, as well as caregiver support and resources that we have available in the district. So our goal with this ads is kind of driving people to the brainhealth.dc.gov website, where they can go on there and utilize different resources that we have. Whether if it's, if they want respite care, if they want somebody to come to the office or to their homes and kind of provide support, whether if they need medication management resources. So there's a lot of resources that are available on the website. And of course, Alzheimer's Association information is on there as well. In addition to that, we're preparing to roll out our brain health, Alzheimer's disease and related dementia state plan, which the state plan was based on the brain health needs assessment that was conducted. And we also worked with the coalition members to kind of incorporate their feedback in it, so that we can all use this document as a roadmap. So every organization in the district can look at it and kind of work together collectively, as I mentioned earlier. So we're very excited.
Awesome. Well, this concludes today's enlightening discussion on brain health. I hope that everyone found this episode of Let's Talk About It informing and engaging. And remember, knowledge is power when it comes to your health. So understanding brain health is crucial for maintaining a vibrant and fulfilling life. We'd like to thank our guests for joining us here today, providing a fountain of information when it comes to brain health, but also the resources that are available. And again, some of those resources for websites to go and visit is brainhealth.dc.gov. And the Alzheimer's Association website is alz.org as well. Thank you again for tuning in. Until next time.